I'm Sally Hynes. I'm a pediatric plastic surgeon and the director of the burn program at BC Children's Hospital. So I'm part of a multidisciplinary team that takes care of patients with burn injuries from all over British Columbia and the Yukon. And as the burn director, I also have a role in ensuring that our patients receive the highest standard of care possible. So part of this involves advocating for resources, keeping up to date with the latest developments in burn care, and contributing to burn research. So toddlers are at higher risk for burn injuries as a reflection of their developmental stage. So they're now at an age where they are physically capable of walking around and exploring their environment with their hands. They can be very fast, they are curious, and they are largely unaware of the risks around them. So that's why about 80% of the patients that we see at BC Children's Hospital with burn injuries are under the age of 5. And they also have thinner skin. So infants and younger children have thinner skin. And so that also makes them more susceptible to sustaining burn injuries. For a given temperature and time of exposure, a young child is more likely to sustain a burn injury because of their thinner skin, and also more likely than an adult to sustain a deeper burn. And we can use the example of a hot coffee, which is about 68 degrees Celsius. And at that temperature, it only takes a second for a child to sustain a burn injury. So the injury is essentially sustained upon contact with the hot coffee. So the most common burns that we see in toddlers are scalds from hot liquids and contact with hot surfaces. So in the case of scald burns, it tends to be caused by hot tea, coffee, soup, bottle warmers. In the case of contact burns, it tends to be from contact with a hot stove or glass-fronted fireplace. So these are items that we have in our households, so these risks are everywhere. So because toddlers are often injured when they knock a hot liquid off of a tabletop or a counter, they tend to sustain burn injuries to their face, shoulder, chest, as well as upper extremities. In the case of contact burns, it tends to be their hands, because this is what they use to explore the environment around them. If we think about that, the hands and face as being some of the most common sites of burns in toddlers, I mean, these are very important areas, both from an aesthetic and psychosocial point of view, but also functionally. So they can result in very serious injuries, even when they're relatively small. Because burn injuries can result in scars, scars don't tend to stretch and grow the same way that normal healthy skin does. And so over time, children can develop tightness, particularly across joints, and may require surgery to release the joints or for reconstruction, even years down the road from the initial injury. And there's also the psychological impact of having sustained a burn injury. Burns tend to be very traumatic, both in the ways that the burn injuries occur, and also the fact that they require treatment over a period of time, often with many hospital visits, dressing changes, sometimes surgeries. So these children are at risk for PTSD. Also, burn injuries tend to be quite painful, so this also contributes to that psychological trauma. I think a lot of parents worry about fire as a risk to their child, whether it's from a campfire or matches. And I do want parents, obviously, to consider that risk. As a doctor and a parent myself, I'd like parents to be aware of the risks in our everyday home environment. For example, that hot cup of coffee or tea on the countertop. Injuries such as scald burns can happen so quickly, and they can often be quite serious. And simple changes in the home, such as using a travel mug with a tight-fitting lid, can make a big difference.